Have you ever looked at a medical bill and literally felt your stomach drop? Yeah, you aren't alone. Welcome to The Explainer. Today, we're doing something absolutely crucial and honestly pretty empowering. We're demystifying the hidden roles of healthcare finance. The world of medical billing can feel like a giant maze designed to keep you totally lost. But get this, it actually operates under very strict rules and timelines. So we're going to map out the patient's financial timeline together, unlocking the secrets, the legal protections, and the hidden financial assistance programs that can literally save you from drowning in medical debt.
Okay, let's dive into this. $30,000. Just let that sink in for a second. That is the average cost of just a 3-day hospital stay. It is absolutely no wonder medical debt is such a widespread fear in this country. And honestly, it doesn't even take a long hospital stay to rack up a massive bill. Imagine just stepping out your front door, slipping on some ice, and breaking your leg. Boom. Before you're even healed, you're staring down a $7,500 bill. Without the right protections in place, these sudden out-of-the-blue costs can push folks straight into deep debt or even bankruptcy. But hey, there is a defense strategy, and that is exactly what we're going to build today.
So here's our roadmap. We'll start by looking at the high cost of care, move into protecting yourself with insurance, explain exactly what financial assistance policies are, cover your rights against debt collectors, and finally wrap up by exploring government help.
All right, part 1, the high cost of care and protecting yourself with insurance.
This first step is really all about preventing those massive life-altering costs before an accident or illness even happens. Think of health insurance like a contract. You pay a company, and they agree to do the heavy lifting when you get sick or hurt. But notice the balancing act here. You'll usually have to choose between a low monthly premium with higher out-of-pocket costs or a high monthly premium with lower out-of-pocket costs. If you're generally healthy and you rarely see a doctor, that low monthly premium, that might be your best bet. But, and this is super important, if you know you're going to need frequent care or expensive prescriptions, paying a bit more each month for a higher premium can actually save you a tremendous amount of money in the long run. It's really all about anticipating what you and your family are going to need.
Now, when you buy a Marketplace health plan, you're essentially buying a package of very specific safety rails. First off, once you meet your deductible, the plan kicks in to cover a big chunk of your expenses. Usually, coinsurance covers somewhere between 60 to 90% of your bills. But the ultimate peace of mind? That comes from the out-of-pocket maximum. This is the absolute hard cap on what you have to pay in a single year. Once you hit that magic number, your insurance covers 100% of covered care for the rest of the year. That means one catastrophic illness won't bankrupt you. Plus, Marketplace plans are legally forbidden, no way around it, from putting yearly or lifetime dollar limits on your essential health benefits.
Moving right along to part 2, financial assistance policies explained.
Okay, so what happens when you have insurance, but it just isn't enough? Or, what if you don't have insurance at all? Well, here is the critical safety net you absolutely need to know about: a financial assistance policy, or FAP for short. This is a formal, written policy that offers free or discounted care to eligible patients who simply can't afford their bills. And get this, under the Affordable Care Act and IRS Code Section 501(r)(4), tax-exempt, non-profit hospitals are legally required to have these policies in place. They have to offer this form of charity care if they want to keep their tax-exempt status. And it applies to all emergency and medically necessary care provided by the facility.
Now, what's really interesting about this slide is that hospitals are legally forbidden from keeping these policies a secret. The IRS mandates absolute transparency here. The policy, the application form, and a plain language summary must be super easy to find on the hospital's website. They have to physically offer you a paper copy of the summary during intake or discharge. They even have to put a conspicuous written notice right there on your billing statements. And for communities where 5% of the population, or 1,000 individuals, speak a language other than English, the hospital actually has to translate all of these documents into that language. Basically, they really want you to know about this help.
So how do you actually get your hands on this help? Well, the Centers for Medicare and Medicaid Services recommends a really simple 4-step process. First, just hop onto a search engine and type your hospital's name plus the words financial assistance. Second, review the policy so you understand the eligibility requirements and the deadlines. Third, go ahead and apply by submitting their specific forms. And fourth, this is key, follow up. Check the status of your application. Actually, scratch that. If your bill is already with a debt collector, explicitly tell them right away that you're applying for financial help and request that they pause collections while the application is processed. Now, you might be wondering, wait, what if my hospital is for profit? Does this mean I'm totally out of luck? Well, not necessarily. Even private or for-profit hospitals often have their own internal assistance programs, so it always pays to ask. But more importantly, if you live in states like California, New York, Washington, or Illinois, along with several others highlighted here, your state has specific charity care laws on the books. These laws require all hospitals to provide free or discounted care to patients who meet certain requirements, which is usually based on income.
All right, let's look at part 3, rights against debt collectors.
Now we're moving into what is definitely the most stressful part, when bills go unpaid and those debt collectors start calling. But take a deep breath, because fortunately, the IRS provides a massive hidden shield against what they call extraordinary collection actions, or ECAs. These are those harsh, super aggressive tactics. Things like selling your debt to a third party, reporting adverse information to credit bureaus, placing a lien on your property, garnishing your wages, or even denying you future necessary medical care just because of an unpaid bill. Under Section 501(r)(6), nonprofit hospitals are strictly legally forbidden from taking any of these extreme actions against you before they've made reasonable efforts to see if you're eligible for their financial assistance policy.
And this brilliantly illustrates what reasonable efforts actually means. It translates into a very strict legal timeline. The clock starts ticking on the exact date the hospital provides your first post-discharge billing statement. From that day, the hospital has to give you a 120-day notification period. During these 120 days, they cannot initiate any extraordinary collection actions. They just can't do it. Furthermore, you actually have a 240-day application period to submit your financial assistance application. Think about that. That is roughly 8 entire months from your first bill where you have the absolute legal right to apply for help.
If you manage to submit a complete application during that 240-day window, it acts as a total legal pause button. The hospital and any debt collectors working for them must immediately suspend any collection actions against you while they figure out if you're eligible. And here is a fantastic, honestly almost unbelievable detail. If you're found eligible for discounted care, and it turns out you've already paid more than you were supposed to, the hospital is legally required to refund any overpayment that exceeds your new discounted bill by more than $5. Yep, $5. They also have to take active measures to reverse negative actions, like actually pulling the debt off your credit report. Which brings us to part 4, government and additional help. Okay, but what if you don't qualify for a hospital's internal policy, or you need broader, more long-term support? Well, the government offers extensive support frameworks completely outside of specific hospitals. USA.gov is a really fantastic starting portal for this. Whether you qualify is generally determined by things like your income, age, employment status, or specific health conditions. And keep in mind, these aren't just for emergencies. These are foundational safety nets designed to make sure you get the routine, preventative, and critical care you need without facing total financial ruin. Let's move to and see how this builds into an array of highly effective programs. For example, you have Medicaid and the Children's Health Insurance Program for low-income families. If you're on Medicare, there are Medicare savings programs to help out with premiums and copayments, plus the Medicare Extra Help program, which specifically targets the heavy costs of Part D prescription drugs. Now, if you're already drowning in bills, a credit counseling organization can set up a debt management plan to help lower your interest rates and even waive fees. And definitely don't forget preventative programs. Things like the National Breast and Cervical Cancer Early Detection Program provide free or low-cost screenings, or the Vaccines for Children program.
I know, navigating all of this can still feel incredibly overwhelming. If you feel like you're just hitting a brick wall, or you genuinely believe a hospital is violating the rules we just discussed today, there is a direct line for support. You can call the Federal No Surprises Help Desk at 1-800-985-3059. Let me tell you, this is an incredibly practical resource that provides assistance in over 350 languages. You really, truly do not have to fight these battles alone.
The rules of medical finance are super intimidating, but as we've seen, they contain built-in protections designed specifically to help you. Which brings us to our final big question for you. Have you checked your local hospital's financial assistance policy yet? Seriously, don't wait for an emergency. Take just 5 minutes today to search your local hospital's website and understand your rights. Because at the end of the day, knowledge is absolutely your best protection against medical debt. Thanks so much for joining me on this explainer, and stay empowered out there.